Tonight, I will be talking on the impact of effective collaboration of providers in emergency care. I will be using my experience in, majorly in UK and Ireland, and then what I've seen here in Nigeria. So a bit about my background. I'm a medical doctor, and I had worked in the UK up till about 1.5, 2 years ago when I came to Nigeria. So my background is general practice, and I also do emergency medicine. So I leveraging on those two areas, I've worked in an urgent care setting, which is more like a primary healthcare-led emergency unit in the UK. I was a medical director for 2 subsidiaries of NHS England, and I work as a responsible officer, which means I appraise doctors and recommend for doctors for relicensing in the UK. I also have other aspects of me which are not relevant for tonight. So I've been working with the pharmacists around in Nigeria and also in the UK as well. As a medical educator, I get involved in training nurses and even pharmacists becoming independent practitioner. So not to waste too much of our time, looking at the topic before me today, it's not. Let me put it straight before I start. This topic is quite an interesting topic, because when you talk about the collaboration between providers, it's not something that I found it quite deep when I start putting things together to discuss with you. So tonight I will say a lot of things, and most of the things I will say is in good in good mind for us to be able to think around what we do and see how we can actually steer ourselves to get a better result from whatever we're doing. Now, at the end of the presentation tonight, I'm hoping that I'll be able to define interprofessional collaboration, what it means. I would have been able to, discuss around health system, the kind of healthcare system that we run, and how that impacts the collaboration between providers. I'm hoping I'll be able to discuss the impacts of the interprofessional care, the impact of the interprofessional relationship on patient safety and the quality of care that we deliver. I will leverage more around emergency care. I know that it's a little bit skewed because I'm talking to the community pharmacist, and I think your role is more in the primary care setting. But when we look at by the time we look at the healthcare system that we run in Nigeria, we see why it's important for us to talk about the emergency, care. And I would also talk a bit about the barrier that we see in integrating interprofessional collaboration. And I want to briefly talk about patient care, patient-centered care, and then disease-centered care, which I think is very important for us to know. So, what do we mean by interprofessional collaboration? So when we look at this, I think in summary, I think it just means all hands on deck. All hands on deck. Everybody do their own bit. Everybody get involved in it. But what is it that we're talking about precisely? WHO had put a definition down to say that interprofessional, collaboration simply means when multiple health workers from different professional backgrounds work together with patients. It's very important to remember that with patients, families, and carers and the community to deliver a high quality healthcare. So the healthcare that we, the delivery in the end is what justifies what we're talking about. So we're talking about a situation where whether you're a pharmacist, you're a doctor, you're a nurse, you're a cleaner, you're working in the healthcare system, we all work together, but we're not working together only talking about our professional colleagues. We're also talking about bringing the patient, the family of the patient, people that we're caring for, we need to bring them into that environment to deliver a high quality care for them. Now, because of the way things are when we look at this critically, we would say that for us to deliver a quality care or whatever care we're going to deliver, whatever we're delivering depends on the system that we're running. So, because I want to talk about the United Kingdom and I want to look at Nigeria. When I look at these two healthcare system or the care that we deliver in these two different sides of the poles, I realize that the result that we're getting majorly hinges on the kind of healthcare delivery system that we run. Now, I would dig a little bit deep into that. But before I get in there, what do we really mean by health? So the WHO also define health to us as a state of physical, mental, and social well-being, not only the absence of disease. So it's not like I don't have typhoid, then I'm healthy. I don't have malaria, I'm healthy. No dysentery, I'm healthy. No, it has to be a combination of everything. So you're talking about people's physical, mental, and social well-being. That's when you talk about health. Now, this is important. But before I come back to that, I would want to talk about, the healthcare system. A system means that you have so many things working together. That's what a system, that's its definition of any system. For example, you talk about the cardiovascular system. So you're talking about the heart, you're talking about the artery, you're talking about the vein, and you talk about chambers of the heart. You talk about this system and the blood that flows through them. So that's a cardiovascular system. Respiratory system, also talking about the lungs and all this. So when you talk about a system means you have so many parts. Now, when we talk about the health care system, a healthcare system or a health system means that we have a system in place where there are so many things that work together to deliver, a kind of a form of care. And then this will involve performance. It will involve how we see our own performance. What knowledge are we bringing into it? What sort of professionalism are we bringing into the care we're delivering? And I know that the goal of any healthcare system is for us to deliver or to give the best practice that we can. So when we want to give the best practice, we have to look at each of these components: the performance, the knowledge, the skill, vision, ethics, potential, and how we deliver all this. I'm taking us on a journey. Now, when I look at my experience, in Nigeria and my experience in the UK, I realized that there are so many things that create a form of gap. Looking at a patient in the UK, if I, as an emergency, practitioner, if somebody collapses, it has happened in the department, immediately there's a system that is triggered. I know what to do. Even the ordinary cleaner in our units, we know the next thing to do when somebody collapses. If somebody just dropped down in the department, you know that straight away you're going to check what is wrong with this person. Are they still alive? Then you want to say, okay, if they're not alive or that you've noticed their respiration is failed, the cardiovascular system is failed, you know the next thing to do. You jump on their chest, you start, what you need to do, and keep these people alive until you hand over to, the hospital. So this is a system that is already been running. Now, if I come to Nigeria, I've seen situations, even in the estate where I lived, where things happen, somebody collapsed, they called me. By the time I go there, this chap is already flat on the couch. I started CPR. By the time I did all I could do, it was just like I was on my own. Nobody was there to even know what's next or what they need to do until this young man passed on. Well, by the time I got there, it was already gone. We just said, let's try. And then we took this chap. There's no ambulance. Rushed him, took him to the next hospital. The doctor got there. This guy, there's a life that is gone. Just 35 years old. Now, why I'm saying this is, that is a system that operates. Yes, it's still a system. In that system that I've just described, the second system in Nigeria, unfortunately, we could not rescue this guy. And in a system that happened when I was in the UK in North in Derby Royal Hospital, I was in the department. Somebody dropped right in front of me, started CPR. I was able to jumpstart his heart, and then we brought him, back. So now it's important for us to know that the experience that we have or whatever we're able to deliver depends on the kind of system that we run around that area. Let me give one more example before I move on. And this is a very, very personal example that sometimes touches my heart, and it has to do with my father. I was called one day that my father was unwell. When they described what happened, I thought Daddy needed to see a physician. He was in an hospital, and where a nurse is seeing him, and they said there was no doctor, and then he should come back in a week's time. My mom called me, and I said no. He needed to see somebody. I arranged for him to see a doctor in a teaching hospital. He went there. I was on the plane going to the UK, and I was calling on the plane. And then by the time this doctor saw, they told me he's giving a prescription, and Daddy had to be taking 12 tablets every day, So I thought, okay, this person is thinking what I was thinking. I thought he might have, temporal arthritis, and he needed steroid in his body, in the system, so that he doesn't go blind. And then, so I was happy. I got to the UK, stayed 2 days after. I called Dad, are you okay? He said he wasn't getting better. And unfortunately, I came back home. Within a space of 1 week, I was back in Nigeria, and my mom called me and said, your father is not getting well. But when I called him 2 days after, he told me he was not getting better. I told him, keep taking your medicine, you'll be fine, because I believed in the system. And then 5-6 days after, my mom called me and said, your father is not well. When he's eating, things are dropping on his hands. So I called my colleague in that hospital to go and see my father. Saw my father and said, Dad had diabetes. He said, my father doesn't have diabetes. So at that point, I jumped on the plane and I went to see him. Why I'm saying this is, there is a system of collaboration that could either save someone or could actually kill someone. Now, by the time I got to this hospital, it didn't take me long. When I just looked at things, I said, oh, Daddy, where is the medication you're taking? And I looked at it, I realized my father was in trouble, because he was not taking the right medicine that I thought. And unfortunately, it took him to a teaching hospital, and he passed on within a space of 2-3 days. What actually happened was, Dad went to the hospital, saw a physician, was given a prescription, went to the pharmacy, collected the prescription, went home, started taking his medication, but instead of giving him prednisolone, he was giving benflumetazide. And he was taking 60 milligrams of that. How he survived almost a week, I do not even know. Because an elephant, I wasn't expecting to survive that. Now, that is the case of what happened. Now, why I brought this up is the fact that it's important for us to know that effective professional collaboration is absolutely key and key when we're talking about quality care delivery. In these three scenarios that I've given us now, let me start with my father. If my father were to be in an environment where we trigger effective professional collaboration, maybe he would still be alive here today. Because at the time he had his prescription, he went to the pharmacy, he was given the prescription. If we have a system in place where we check things over, especially in elderly, like in the UK, when you do a prescription, by the time people take prescription, or when they're coming into an hospital or they're getting out of an hospital, somebody check what they come in with. The pharmacist follow them up. Even though the pharmacy still dispensed in this case, but the follow-up, the second eye to have a look at things, I didn't think that was in place. And that had led to people, to his life being, cut short. And then a lot of people are in this situation, and this is the situation, the health system that we run. Now, it's important for us to know that collaboration, working together, it's very, very, very key. Now, in the UK, team workmanship is really key between the pharmacists, the nurses, the doctors, and and other providers. You work together. And when I talk about team workmanship, I'm not saying that it's not in existence in Nigeria. There are certain things that we need to look into in between the lines. Is it effective, the relationship we're having? To have an effective team workmanship, I'm going to talk, in the next slide, I think, I'm going to talk about certain things that are very important, things that can be hindrances or things that can, also promote the effects that we want to happen. So in a team, there must be good communication, obviously. There must be interaction, respect. We need to respect ourselves and things. Let me get to that stage and I'm going to talk about it. But collaboration is very important for us to have an effective, professional relationship among ourselves. So we need to put our head together. We need to work together in whatever we do. We need to coordinate our efforts. We need to coordinate, whatever we're doing so that we have like one direction and we all have a common goal towards it. Communication is key. Communication is not like I'm talking to you. Communication involves quite a lot more than that. Like in Yoruba land, they'll say, when if in the UK, for instance, I work with, if I'm on duty, if a doctor is on duty, let's say in a typical urgent care unit, you have a doctor, you don't work in isolation. You will have a doctor, you have a pharmacist, you have nurses. Nurses are even fragmented into so many units. So you have like an advanced nurse practitioner, you have, training nurse practitioner, you have just ordinary nurse. Okay, you have nurse assistants, you have the cleaners, you have this bundle of people working in a day. But when we start working, the first thing is we always want to say, okay, we are a team. We all work together, and there's nothing like I'm staying in my room or something like that. Only when you run a surgery. But in urgent care, we all stay together. I will have my seat there. I have the nurses there, so we sort of learn. If a nurse sees the patient, they come to me, they discuss. I will educate them on things I think they need to do in addition to whatever they stop the discussion. So, and I've not seen such model work here in Nigeria. And the issue we have here is our in a system where we don't even have emergency, units. I mean, a functional emergency system. I think that's where this sort of relationship needs to work better, where there's no hierarchy, where somebody comes and says, I'm the head of this old people, I'm managing everybody. No, it's more like we need to work in a team where everybody's voice will be heard. Let me quickly say something here. I remember a case that I had, a child. This child was abused by the stepfather. I didn't pick this. This case came to me after a doctor had already seen in the unit. But a cleaner, a nurse assistant, a nurse assistant was not happy. She spoke to the nurse who was looking after. The nurse was happy. And then the doctor that saw this child was happy. They said that, this child was okay, could go home. But she wasn't happy. Then she came to me, said, look, I'm worried about this child. I have concern. And when somebody raised such concern, it becomes very important for us to have a very, a closer look. And I saw this child. I wasn't particularly convinced myself, but because of her concern, I have to listen to her, I have to hear her voice. I cannot let that child go home. So I admitted this child to the hospital. You cannot believe it that I went to court for this case, because it then became obvious that the stepfather was actually abusing this child. This child has gotten multiple, fractured ribs as at this time, but came in with something very trivial. If I had ignored that nurse assistant on that day, only God knows what would have happened to this child. Maybe ruptured spleen or ruptured, liver one day, and the child would die. you know. So it's important in a team that we collaborate together and, you know, respect each other, listen to one another, and for the sake of the patient that we see. Okay, so now in terms of when we talk about effective collaboration, how does that actually help, you know, in a patient? Sorry, this thing is blocking my view here. Sorry. Okay, so how do we use this one to meet the patient's needs? Actually, it's by us having our own piece that we're taking care of and we're working on. So you have your own piece. I have my own piece to work on. But in order for us to be able to whine in the same direction, we have to think about, you know, a common goal. We need to have a shared goal. We need to have a mutual trust. If you don't trust me, I don't trust you, we cannot work together. You know, we have to have a clear rule amongst ourselves. In the UK, when we get to emergency units, in the morning, if I'm the one leading the team, I will have to call everybody. I want to know what can you do, what can you do, what can you do. So I delegate the role to everybody, so that when I have somebody collapse or they bring somebody in an arrest, it's not my duty to start taking blood. It's not my duty to start finding the airways. It's not my duty to start jumping on the chest. How many of this will I do? So I want to know if your skill. Are you able to take blood? You handle that. Are you able to manage airway? You handle that. Are you able to do chest compression? We'll rotate this among ourselves. So we have a team that is working. Everybody will pick their own piece and do. But I will be there to oversee everything and have a common goal that we're sharing. This is how it works. And it becomes effective. And we communicate effectively by way of making things clear to one another, so that we all understand ourselves. We're whining in the same direction. It's not like some people are whining this way, the other one is whining this way, and we're moving nowhere. So in effective communication is very important. We can talk a lot about effective communication, but the most important thing is we just need to get ourselves to be clear, and then we need to respect ourselves. You know, now we need to have a measurable process in place. Feedback, a feedback loop is really important. I always tell people I have 3 eyes. My own eyes is one of those 3 eyes. I see myself the way I am. I can think in my head I'm the best doctor in the whole world. That is me thinking. What are my colleagues thinking about me? What are my subordinates thinking about me? I want to know. So feedback is very important. Get feedback. From this feedback, we can learn a lot. You know, you might think that you're smelling fine. You're smelling it to yourself. You get into a place, maybe people are doing like this, you think you're smelling nice. It's only the people who are doing like this that can tell you that you are not smelling nice. And until they tell you, you do not know. And then you continue to ravage in your own ignorance. So we need to have a measurable process, a process by which we measure our own outcome and to improve our outcome. There's a lot to say around this, but because of the short time, I'm not able to go too deep into it. So what are the barriers in interprofessional collaboration? These barriers can range in three areas. So you can think about the individual's factors. So I'm just going to run through all this, because they're not major. They're things that we probably just know anyway, you know. So we need to, you know, it could be a situation where people will split loyalty between the team and their discipline. When people start segregating, oh, I'm a nurse, that's my own kidney, and I don't want to, because I'm a nurse, I want to protect this, I want to protect that. Now, when we are in a team, we need to know that, yes, we have our own units to work, but we have to be flexible. We need to be flexible. Flexibility is very important in when we collaborate. Okay, and then multiple responsibility. When people have too many responsibility, it skews the whole thing. We need to have our own responsibility for the day. That's what you're doing, so that you stay within that remit, unless there's need for you to be fluid. Stay within that remit and handle that and do that effectively. Okay, in a situation where people have multiple, then it skew the results. Then competition and naivety. You know, there could be competition in the group where people are thinking, okay, which is common in Nigeria, pharmacists versus doctors versus nurses, clinic versus clinic. I don't understand. You know, it shouldn't be. Where is the competition? What are we out to do? Our goal is to take care of the patients. Patient, patient, patient at the center of it all. But by the time we start doing this competition, this one, patients are dying. So what are we achieving? And then gender, age, race, all these things that discriminate us, that differentiate us in a Muslim, a Christian, a male, a female, all these things, they're absolutely not relevant when you want to work together in collaboration. And that's why I like what operates in the UK, in all honesty. I say this to people. There are certain things I do not like about it. It's a situation where I'm in my surgery and three ladies were working. And then one would tell me, oh, you'd have to know Dr. Femi. This is my wife. This is a lady telling me, this is my wife and this is my mother-in-law. I can't get my head around that. But I still have to practice. I still need to do what I need to do. I cannot be judgmental. Okay. So the system in the UK does not allow me to be judgmental. But when you come to Nigeria, if three ladies come to you, you can just say, we'll take you out and stone you to death. I mean, I'm just saying, but it's not when we come into a professional environment, we leave all these differences. Let's focus on the job that we're supposed to be doing. And that's how we can work together. Okay, lack of role clarity. So in a situation where somebody is not sure, as a doctor, this is what you're supposed to be doing. As a nurse, as a pharmacist, this is your role. But when we then start crossing boundary, crossing roles and things like that, it skew the whole idea and create barriers in this professional hierarchy. When I was trained as a doctor, the idea in my head was that once I finish, I'm the head of the unit. It's all, I don't want to use the word stupid. I think the bottom line is we need to now be in 2021 where the focus should not be like who is the God in this environment. The focus should be like how do we work collaboratively together to get the best for the patient right in front of us. Whether I'm a nurse, I'm a doctor, or I'm a pharmacist, and whatever, just be able to blend. And that's what we do well in the UK, in all honesty. I don't see anything highfalutin about it. Now, it probably could be in the team. It could be, lack of clarity, of lack of clearly stated and measured purpose for the team. If the team does not have a purpose, you don't know where you are going, then you are lost in the jungle. You're just running up and down. You can't move anywhere. Lack of training. Training is quite important. If you are bringing people into your team, you need to actually train them. That's one thing. I could go on and on about a lot of things that we do well in the UK. Everybody have their own portfolio. In your portfolio, there are things around your own CPD, your own professional thing, your own personal thing that you want to achieve for the year. You have to demonstrate that you are doing it. Here, people are left to do things. Somebody who have not practiced for years or for donkeys of years is still flagging. I'm a doctor, I'm a pharmacist, I'm a pharmacist where? Pharmacist in 30 years ago. You have not upgraded, you have not upscaled or upgraded yourself. You are saying you are still a professional. No, we need to have a trainee that keep us abreast of the situation of what's going on, in the contemporary world. And then ambiguity of rules. We said this earlier on, lack of adequate information. So information needs to flow easily in a team. And then if a team is too large, is a problem to manage. These are just barrier to effective interpersonal collaboration. Inadequate decision making, lack of commitment, no orientation. All these things are things that can happen in a team. And then apathy of the team member. And I need to pace up now because of the time. Sorry. Then the problem could be in the organization itself. And these are a few things that can cause issue in the organization. Team building. How did we build our team? How did maybe in your own pharmacy, in your own small pharmacy, you have different people working there. You have maybe one pharmacist a day. You might have this pharmacy technician. You might have cleaners. All these people, they should have their own role, and you need to build a team where they are functional and useful in the post, in whatever you're doing in the day. So okay, now this is very important. I mean, in all things that we've been talking about, everything that I've been talking about today centers around taking care of our patients. What is the point of collaborating? if we do not carry the patient along. If you look at the WHO definition, it involves multiple professionals coming together with, I emphasize that word, with the patient, the carer, or relatives, so that whatever we're doing, we need to carry our patient along. Patient need to be at the center of whatever we're doing, whether in the hospital, whether in the community, in emergency or in chronic situation. Put the patient first. And how do you put the patient first? You put them first by listening to them. You put them first by educating them. And see how people are being managed. I took a patient to one hospital I'm not going to mention. I took a patient to an hospital. The way the consultant spoke to this chap, I was so disgusted myself that I had to step in. That would just come down from your high horses. I can't understand why you talk to the patient that brought to you this way. Private patient that brought to you. I mean, it just doesn't make sense to me. We need to carry patient along. Some patients want to know. Personally, I've had this argument and discussion with a lot of people since I came to Nigeria. You can't do things behind me. I mean, without me understanding. I'm corpus mental. As long as somebody is corpus mental, I'm an adult, I have the right to know. You can't give me a prescription without telling me what you're giving me. You're not Babalawo now. If you're not Babalawo, you need to let me know what you're doing and then carry me along. If I get to somewhere, somebody asks me, I should be able to explicitly explain, this is what you have done to me. The only time you can just decide for me is when I'm mentally imbalanced. And it's very easy for you to check that. Anytime you want to decide for somebody and you know you want to put your foot down and decide for them, then you have to check their capacity. How do you check people's capacity? You give them information. Are they able to process this information? Are they able to give it back to you? Can they weigh whether this problem is there's danger in it? Once they can do those three things, they can receive information. You've given them something, they reproduce it back to you. Then that means they can hear you. If they reproduce it back to you, it means they can retain. Then you ask them to juggle it. If you're saying, okay, if you take this medicine, you're going to have liver failure. Why do you want to take it? And they say, okay, I understand. You told me now I'm going to have liver failure if I take it, but I want to take it. They are corpus mentals. They can take decision. It's not your headache again, because they're an adult. An adult is allowed to be very stupid. As long as they know what they're doing, you can be stupid as an adult. So you can't then decide for me. So everything needs to be, you carry the patient along. If the patient does not have that capacity to take decision, bring the relative into it. You understand? Bring the relative into the discussion. Let them be part of it. And that's how we're meant to do it. That's how we're meant to discharge our duty. It's not a situation where you just prescribe things for people by force and you tell them things that are just like a kid that is under us. So let us be mindful of the fact that we have to be patient-centered. Now, does it mean that we're not going to make mistakes in all this? No, mistakes do happen, and you cannot help it. Errors happen, like it happened to my father. It's a dispensing error, and then, but the worst thing that will happen is if we have all these mistakes and we do not know how to handle it. When people make mistakes, the idea is you learn from that mistakes for you to improve for the future. That's why I like the Oyinbos. Oyinbo will come to you and tell you, okay, you've done this thing. All I want to be sure of is these things will not happen to somebody else again. How are you going to do it? And then you have to, this is where audits becomes important. I will tell you some toolkits I think we can take along, that we can use, in our own personal practices to improve the quality of what we do. So you need to do an investigation in case if there are significant events. There's what they call the significant event, analysis. You need to analyze the event that's happened. How? And I always tell people, ask 5 why. Why did this happen? If you're able to answer that one with another question, this is why. The Chinese have got it right. By the time you ask why 5 times, you get to the root of any problem. Most problems, you get to the roots of it. So until you keep asking that why and checking, then you're failing the system. You're failing your colleagues. You're failing the collaborative thing cannot work that way. So we're bound to make mistakes. That's what in our job, you cannot be perfect. But when you don't cover things up, Nigerians, we cover things up here. It just It does my head in. And then when you do this thing and people just think that, oh, you want to put this person in trouble. No, you're not putting anybody in trouble. You're trying to investigate a problem to make sure you get to the root of it and deal with the root of the problem, preventing the problem happening again. So this will happen in groups, when we work together. Definitely. And we shouldn't slight ourselves about it. I can go on and on. That's a topic I do training on a separate day. So we can go on and talk about that maybe in another time. Now, what the two keys that we carry along when we work in a group, as collaboratively, we need to have standards. We need to have standards that we work with. It's very, very important. When you don't have a standard, then you don't know what you're doing. So, and with your standard, your clinical guide and things that's where you can audit whatever you're doing. You can audit. And audit means that you have a standard. Let's say the standard is every time I come to the pharmacy, all my pharmacists must always wear word coat. Okay? If that's the standard in my practice, that's the standard, and that's what I want to benchmark the standard of my pharmacist for. So every time must wear a word coat. So I can then say, okay, I want to pop in without letting them know, like maybe once or twice a week. And after a month, I want to say, how many times did I go there and they were all wearing word clothes? How many times have I been there and they're not wearing word coat? So, and the standard I want to create here is wearing word coat 100% of the time. Maybe I now go maybe only twice out of 4 times they're wearing word coat. So that means I've achieved 50%. That is a simple audit. And then I want to say, okay, that's where we are. I will call everybody and educate them. This is the reason why I think we should be wearing word coats. And then I think it's important for us to do it. So when you do that, you educate them, then they can understand what you're talking about. And when they do understand that, it means that you can then improve that standard. So an audit is not just a joke. It's something that you use to improve the quality of performance in your practices. And when you have so many people working together collaboratively, you can say, okay, we want to prevent infection, or there's so many things you can audit. You can audit anything. But it's just that you have to create that standard and say, okay, this is what we want. If it's 70% of the time that we want to make sure that people wash their hand, okay, COVID time now, you want to make sure that everybody that walks into your pharmacy, they use hand sanitizer or they will have washed their hand. You can get somebody to stay there and be watching them. Or you can just use your camera. And when you flip through and look at the camera and say, okay, how many times are people entering into this place without using this or using that? Then you calculate it and say, okay, we're not matching up. You bring your team together, let them know why you are doing that. And then you improve. And then you re-audit again and make sure that you're getting the target that you want. So it's very important, auditing. And then benchmarking, I talked about that. Evidence-based, we need to be evidence-based, whatever we're doing these days. I mean, that's not highfalutin. We should make sure that we're contemporary in everything that we do. CPD, you call it CME here. It's important for us to have, continuous professional development things. Maybe you want to do some training to improve your communication amongst your team, or you want to do the training to improve, your interpersonal relationship, and they're very important. So you set a target, and then you see that you're matching that target up later. I think the time is almost short, so I have to pace up with some of these things. Training is important. Quality assurance, somebody coming around to have a look at what you're doing. I mean, sharing experience with other colleagues, maybe two pharmacy can work together. You just say, okay, pharmacy A, pharmacy B. Pharmacy A will come and check what I'm doing. Pharmacy B. This is how we work together interprofessionally, and then we improve things. So let's go to the next one. Sorry. So appraiser scheme, like I said, that's actually my core. I do that very well in the UK. So the appraiser, you have a portfolio, you want people to match up, you appraise them, appraise your team, make sure that they're achieving. Don't have people, if your team this year, they're the same next year, then there's a problem with your system. If you have a group of people, you're collaborating, you're working together, and you are not moving, you're not improving, you're not learning from one another, you have no system, you're just a mediocre, as far as I'm concerned. There's nothing that in anywhere you work, you must learn. If you go and you remain the same, then there's nothing that you're impanding or you're benefiting in life that way, as far as I'm concerned. Incidents reporting, near misses, I said this, when this happened, we need to have a system in place where we sort of investigate and make sure that things improve. Peer review, colleagues can review colleagues, and and the like. Now, this is my take-home point, and this is from the WHO. When you talk about interprofessional collaboration, we need to look at our own local situation. When I say local situation, doesn't mean that I'm talking about Nigeria alone. Whoa, hello. I hope you guys can hear me.
Yes.
Okay,
Yes,
so
we can hear you. I can hear you.
okay, they're gonna put on the generator in a minute. So, but what I'm saying is, in terms of your local needs, look at your needs. The local needs can just be the needs that you have within your premises, your own facility, but you have to review and look at it. And then, like in Nigeria, for instance, our health system is so fragmented. You find the pharmacy doing their own thing, nurses are doing their own thing, doctors are doing the traditional healers are doing their own thing. What sort of system is that? It's a complete mayhem, as far as I'm concerned. We need to find a way of bringing all these things together, and it has to start from us. You understand? So we need to find a way of bringing all these things together, all our knowledge together, and then for a common goal. When we do that, I know that obviously our education background sometimes affects what happens, and I hope Nigeria is tapping into what the WHO is actually pushing for, that this change might need to happen from, starting from our own educational curriculum. We might need to change the curriculum in a way that there's no disparity between all these doctors, nurses, pharmacists, and all these things that's causing the mayhem at this stage. That we need to blend things together so that we can all collaborate and work together effectively, so that we can have a strengthened health system. Because as it stands, it just scares me. We have no system in place in Nigeria that works effectively. What sort of system do we have when somebody collapses on the street? What people do is to pour water on them, or they carry them and break their neck. I mean, I don't understand it. And then we need to do more, at our own level, at every level, to improve, things. Don't forget that what we're aiming for is to move from wherever we are to a better position. And for us to do that, it's everybody's job. We all have to work together. It can be painful. When this guy that is pushing something here, his legs will be painful. Okay, depending on how much weight. And the weight that we have to push in Nigeria is a heck lot, because the whole thing is in a shambles. And then for us to do that, all of us have to work together. We cannot achieve what we want to achieve unless we all work together. Common goal: doctors, nurses, pharmacists, cleaners, security. Once we enter into a place, we need to have the same focus, the same goal, and work together for the purpose of improving, the delivery the quality of care that we give to our patients. And I hope that on this note, I've achieved some of these objectives, and then I will be happy to have questions. Thank you.